So now we go to the second part of the Phakka Roga. So what is that? So this is what we are seeing. What is Phakka in the present day clinical practice? Presentation is almost all similar to failure to thrive that we have already seen. So it is almost all similar to a failure to thrive like condition, which is explained in contemporary medical sciences. Because growth velocity chart, if it is below 3 to 5 percentile, so then usually we will consider under it as FTT. Okay. So the same condition is explained in Ayurveda under the name heading of Phakka. FTT is a term which is traditionally used to children who have failed to develop and grow normally in general practice. FTT is a very common term which is actually used. Okay, any child who is not able to grow well according to the age, in terms of height, in terms of weight, etc., other parameters. So usually we use the word FTT. Okay, the term commonly used in a child who fails to gain the weight according to the standard medical growth charts. So we have got WHO growth chart, IAP growth charts, different types of growth chart for height, weight, etc., BMI, etc. is there. According to that chart, any child who is failing to fulfill that criteria according to the age is called as FTT. Same criteria which is used in our science is Phakka Roga. It is told that Phakka nature gachati, continuous deterioration of the growth status. So therefore, what I mean to say is, don't consider Phakka as a disease. Don't try to consider Phakka as a disease. Phakka means small absorption. Phakka means cerebral palsy. Phakka means rickets. Phakka means some other disease. So don't try to compare this. Why? Because Phakka is not a disease. Phakka is a clinical condition. This can appear in many disorders. As the end stage of many disorders may lead to Phakka. If you look into the explanation of Phakka Roga which is mentioned by Kashyapa, you will be very clear. Okay, so don't consider this as a disease. Rather, this is a symptom complex in many disorders. This is the end stage or other symptom complex which are appearing, manifesting in different disorders. Okay, symptom ranges from simple failure to gain the weight to death-like condition. Okay, so failure to thrive means शुरुआत में सिर्फ वेट उसका एज के हिसाब से नहीं हो रहा है, वहां से शुरू होगा, उसको भी हम FTT बोलते हैं. ठीक है. और chronologically जो है, अगर chronological एज के हिसाब से अगर if the weight is not increasing, height is not increasing, that is also called as FTT, and that continues further, becomes severe, and the child is now in a death-like condition, then also it is called as FTT. So therefore, Phakka Roga is not a disease. Rather, Phakka should be considered as a clinical condition. So this is the first correction that we have to make in our clinical understanding. Otherwise, we will land up in comparing Phakka with so many disorders, and ultimately there are so many errors. Now, this FTT, first we will look into some of the basics of the FTT, failure to thrive. So what is mentioned in the contemporary medical science. Then we will come back to the Phakka. Okay. So this failure to thrive which is mentioned in the contemporary medical science, that is of basically two types. So one is called as failure to thrive because of organic causes, and another one is failure to thrive because of inorganic causes. Now when I say organic causes, means it is because of different disorders. Organic cause means a failure to thrive आ रहा है बच्चे को, growth chart उसका नहीं है सही. The cause is different disorders. It may be a chronic metabolic disorder, it may be a chronic developmental delay, or it may be some of the chromosomal disorders, it may be because of some of the musculoskeletal problems, it may be because of some of the hormonal problems, okay, like hypothyroidism, or it may be because of some pituitary gland problems, it may be some of the nutritional problems, it may be because of some of the deficiency problem like rickets and other vitamin D deficiencies. So all such conditions are included under the organic causes. Okay, all such conditions should be included under the organic causes, and Ayurveda consider this under the Vyadija Phakka. Sometimes child is normally growing and suddenly there will be a fever, and because of fever becomes there is a CNS infection, there is a meningitis, and after meningitis child started with so many problems and health is deteriorating. This is possible. Child was absolutely normal, there was an accident, and after the accident he had 1 or 2 surgeries, and then child started deteriorating. This is also Phakka Roga. Okay, so child is suffering from some of the metabolic problems. Child growth is continuously decreasing. This is also Phakka Roga. Child is having Duchenne's muscular dystrophy or other muscular dystrophies. Gradually, the health status of the child is deteriorating. This is also Phakka Roga. Okay, so this part we have to see. So all such conditions should be considered under the organic causes, and Ayurveda rightly says all such conditions under, or for example, even celiac disease. Child with a celiac disease, everything is normal up to 6 or 7 months. Later, once you introduce the wheat food, then the problem started and child is continuously deteriorating. Now the growth chart is very, very low and flattered, completely flattered. This is also a Phakka Roga. This is a continuous deterioration of the health status. So all such clinical conditions should be considered under this, and when disease is there, all such conditions are included under organic causes. Organic causes. And sometimes this deterioration of the health status of the child may occur because of the non-organic causes. Non-organic causes. Sometimes the deterioration of the health status may be because of family problems. The family is very poor, they have nothing to eat. Nutritional that means poor nutrition is there. Sometimes emotional problems, nobody is there to take care of the child. Child is an orphan child. Child is a neglected child. Child is abused. Child labor is there. Child exploitation is happening. Child neglects is there. Poverty is there. So these are all may also, these conditions, these causes may also lead to growth failure. And all such conditions were included under inorganic causes. Inorganic causes. So if you go and look into the contemporary science, there is a big list which includes the organic causes, and there's a big list which includes the inorganic causes. Inorganic causes. So these are the two basic differences. That means whatever may be the disease and whatever may be the cause, if the child is presented you with the flattering in the growth chart, height is not increased, weight is not increased, and growth chart is falling, that condition is clinically a stage of Phakka for us. If you consider two important definitions of Phakka, Phakkir Nichar Gacchati and Padabhyam Yona Gacchati Samvaksarapanna. Now, so if you look into the contemporary science, see, these are some of the big list. This is the big list of common causes of FTT. Common organic causes, disease causes. What may be the disease causes? Poverty, misperceptions and regarding the feeding. Actually, this comes under inorganic causes. Anyway, inadequate breast milk consumption by the baby. That may lead to FTT. Ayurveda also mentions about Kshiraja Phakka. Okay, then errors in the formula reconstitution. That is also Kshiraja Phakka mentioned in Ayurveda. Dysfunctional parent-child relationship. This is inorganic causes. Ayurveda says, Anataho klishyate balaha. Anatha child. This is one of the causative factors for a Phakka Roga. That we will explain later. Behavioral and feeding pattern. Then child neglect and child abuse. These are all the inorganic causes. Okay. Mechanical problems like cleft lip feeding problem. This is organic cause. Structural problem. Neurological conditions, organic cause. Then chromosomal problems with the mental retardation and physical problems like Down syndrome, Patau syndrome, Holt-Oram syndrome. Okay. Then this Fragile X syndrome. Then prenatal insult, birth asphyxia, meconomy aspiration leading to initial injury to the cerebrum, static injury to the or one-time injury to the cerebrum. Then systemic disorders resulting in the food refusal. There are so many systemic disorders. For example, tuberculosis. Child will have loss of appetite. That may lead to the growth flattering later. Celiac disease, growth flattering later. Cow's milk allergy, food intolerance. At the end, there will be growth flattering. When there is a growth flattering is there, continuous running down condition of the body is there, Phakkir Nichar Gacchati is there, that is called as Phakka for us. Now, the common causes of this Phakka Roga, any condition where there is caloric wasting. So the first one we have seen some of the most common inorganic causes. The other causes are child is consuming the food and that food is not up to the mark to fulfill the caloric requirement, or there are some other mechanisms taking place in the body, pathology is taking place in the body where calorie has been wasted. All such conditions may also lead to Phakka or failure to thrive. So what is mentioned is persistent vomiting, gastroesophageal reflux, gastrointestinal obstruction. So these are all the Vyadhija Phakka. I will consider all these things under the Vyadhija Phakka. Okay, gastrointestinal obstruction, rumination disorders, metabolic problems like inborn errors of metabolism or rickety type of conditions, then increased intracranial pressure and its consequences, then malabsorption and chronic diarrheas, primary gastrointestinal disorders, cystic fibrosis, infectious disorder, different types of infectious disorders, different types of immunological problems, combined immunodeficiency, selective immunodeficiency, B cell deficiency, T cell deficiency, combined deficiency, endocrinopathies, hypothyroidism, hyperpatriotism, then renal disorders, so many renal disorders, hypophosphatemia rickets, then metabolic disorders like diabetes mellitus. Everything considered under FTT by the contemporary science. There are, in all these conditions, there will be caloric wasting. Okay, whatever the baby consumes, that is get wasted because the calorie has been used to fight against these problems. Now, other causes which leads to FTT is increased caloric requirement. There are some conditions where there is increased caloric requirement. For example, congenital heart disease. The child needs increased caloric requirement because there will be recurrent infections will be there to fight against that it reads. Chronic respiratory disorders. So there will be loss of mucosa. Again, there should be formation of the newer cells. Now caloric requirement is more. Neoplasms, hyperthyroidism and hyperthyroidism and hyperparathyroidism. Then chronic recurrent infection. So these are all the conditions where there is increased need of a calorie. Some other conditions which may also lead to this FTT or Phakka like conditions, that is altered growth potential. The growth is not having the expected level. Growth is not up to the expected level. The potentiality of the growth velocity has been reduced. The reasons may be prenatal insult. We know that birth asphyxia like condition, prenatal insult, or chromosomal abnormalities, or endocrinopathies. Now this we have already seen. Some other disorders which may lead to FTT like conditions or Phakka like condition, which is explained under the Vyadhija Phakka in Kashyapa. So what he says? Metabolic disorders. So what Kashyapa says is Nijagantuga Vyadhiya. ठीक है, निजा आगंतुकश्चैव जोराद्या निजा आगंतुजा joradi. So like that, 2 words are mentioned. It includes everything, all the nija vyadhis and all the agantuja vyadhis. They are responsible for Vyadhija Phakka. Okay, so these are all the nija or agantuja vyadhis. See, the metabolic disorders like inborn errors required, congenital disorders, hereditary disorders, chromosomal disorders, infectious disorder, neurological disorders, mental disorders, cerebral palsy, cerebral hemorrhages, disability disorders, surgical problems like GIT surgery, hormonal problems, everything is included. Now, what the contemporary science says is social causes of this particular FTT. So they very clearly says social causes like child abuse, child neglect, orphan child, family conflicts, or single mother, okay, female child, then child labor, okay, child exploitation. Many things are there. Many things. These are some of the social causes which are responsible for FTT, where the child care is not properly done and child undergoes FTT with a growth failure. That is possible. Okay. Similarly, Ayurveda also explains one single word: anataha klishyate balaha. Anato klishyate balaha. So that includes all the social causes. If you look into the contemporary science, there is a theory called as Gopalan's theory. Okay. Dr. Gopalan's theory. So Gopalan is famous as Gopalan theory. So he says that the cause of FTT, failure to thrive, with the environment and other social factors. Interaction between the environment and social factors with the child. Okay, if it is not good, if it is not up to the mark, it is not taken care properly, that may also lead to Phakka Roga or FTT. Now, see, this is just a repetition of what I am telling. There are so many antenatal and as well as perinatal and postnatal causes which are responsible for Phakka Roga. Okay, antenatal problems, so many infections, prenatal insult, birth asphyxia, low birth weight of the child, prematurity of the child, definitely a premature child will have more problems, okay, of developing the Phakka Roga, or growth velocity chart will be low. Then preterm child, postterm child, even the postterm child may face so many complications later. So that is also a problem. So these are considered as some of the common causes. Okay, now if you look into this particular table, the things will be clear. If you look into this table, so many of the doubts will be clear. Now, contemporary science explains the causes of FTT, failure to thrive, in a different headings. Okay, so they explain the organic causes, they explain the inorganic causes. Okay, they explain some of the social causes. Okay, different theories has been proposed, infectious causes, etc. Now, if you look into Ayurveda, also we find a similar explanation of such division of the Phakka. Phakka is a clinical condition. That clinical condition may be the outcome of different causes. Different causes. So that we have to see now.